So I thought I'd give some thoughts on anxiety before surgery. And it really does apply to stress, anxiety, fear, pain. All of these experiences as a human are kind of a form of protection that as human beings we create, and our brain, whether it's a cognitive thought or our subconscious, which is incredibly powerful. It's hard to understand it because it's not a cognitive thought. It's just picking up on information throughout our life, trying to keep us safe. So just to give you an idea how anticipatory anxiety before surgery is normal. Now it varies significantly amongst us, and I see this on a daily basis. Anxiety in general before surgery anesthesia is completely normal. So I would say you're more human than not if you have some anxiety. But just a few thoughts on this because I think it'd be quite helpful, not just for the experience of your upcoming surgery, but for life in general, to see things a little bit differently and how to cope with it, is that when you're in an environment that you don't know, it's new, you're around people you don't know, not sure if you can trust, whether you're cognitively thinking this or not, there are things that your body's trying to understand all of this. Things that are unfamiliar. This idea of someone poking you with a needle to place the IV, which, by the way, the IV, once it's in place, there's no needle there. It's just a little piece of plastic with a little sticker on top of it. That can seem threatening. That, and then you add, you're going to have, be cut somewhere. That can just seem threatening subconsciously, even if you may not be thinking it per se. Anesthesia always seems to be a huge concern for some people more than others. I think a lot of it's an enigma. It's something you're not used to. It's something that you don't do every day. Now, when we go to sleep at night and we wake up every morning, we don't tend to. Now, some people might be frightened to go to sleep for various reasons and previous traumas and whatnot. But most of us will go to sleep at night, and we wake up and we're not fearful of that, but that's something we're accustomed to. Obviously, anesthesia is not a typical daily thing. I might be doing anesthesia, or anesthesia providers do this all the time for patients, but as a recipient, a patient, this is an understandable, sense of threat, and so it can get people a little bit nervous. The other thing is if you think of an animal that's aside from humans, such as a dog who's been traumatized, perhaps they tend to cower, and they're, without even you saying anything, if you're a stranger to them, they may cower and be scared, and they may not have cognitive thoughts about it. Who knows? But still, there's a lot of information that animal has taken from the past, and so might overreact, as where another dog may have never had trauma and is happy to see everyone. So everyone comes to surgery anesthesia with a multitude of experiences and inputs to not only their cognitive brain but subconscious that can impact how they react. And sometimes the way our body is trying to protect us, we sense it physiologically. So meaning you might notice your heart is racing. You might feel like you're breathing a little faster. Your chest, you might feel some pressure in your chest. You might feel like your stomach is turning on itself. You might feel like you have to pee every 2 seconds. You might feel like you have to poop every minute. I mean, all these little things a lot of people don't talk about, but you're sensing it and feeling it. It's uncomfortable. And so that can be just varying levels of anxiety, sometimes to a level of a panic attack where you can't control and it's getting way out of control. And so there are things we can do to help you with that. But obviously, at the time an IV is being done, that's really helpful for us to be able to give you things to help you with, like, relaxing before we go back to the operating room with the IV medicine. But in general, all of these things are your body is trying to get your attention because it feels threatened. It's okay to feel nervous. It's okay to have anxiety. It's okay to feel that. It's not necessarily something we want to experience all the time, but just know that we understand that that is a normal thing that happens, and just taking slow, deep breaths can activate the vagus nerve. It's easy just to say, just take a deep, slow breath, not the fast ones, for a few seconds in and hold it for a few seconds and then breathe out for a few seconds. And that can help activate the vagus nerve, which is actually tied into every other system in your body. And whether it's your bladder, it could be your heart, all these things can help moderate them or modify them. It may not take it away completely, but one thing is wherever you put your attention that's what's going to bother you if it's something you don't like. So if you can distract yourself, even if it's during an IV and you just need your phone or talk to someone you love or care about, someone you trust already, those things can help minimize that kind of experience that's heightened. And so distraction, great technique, slow deep breaths is another good thing for those mothers out there who've done Lamaze and learning how to breathe through the pain of labor. You know what I'm talking about. But I just wanted to give you an idea that stress, anxiety, fear, pain, these are all constructions of the brain, of the system, trying to look out for you to help you feel safe. So making sure that you are at peace with the decision to proceed with surgery, even though there's anticipatory anxiety to be expected, as long as you feel like you're trusting the surgeon, the anesthesia provider, all of those things will help you have a better experience that day and also bring an amazing nervous system that's not too hyped up. And even if it is, don't worry about it. We'll help you out. And if it requires medicines, we'll do that too. But if you have any questions, concerns about that, feel free to ask your anesthesia provider to kind of help you work through it.